Thank you, Mr. Chairman. Apologies, I've lost my voice. Thank you to the witnesses for testifying before us today. I appreciate your time. So our Democrat colleagues like to categorize the association health plans as junk insurance. They say these plans allow cherry picking and discriminate against people with pre-existing conditions. In reality, association health plans are anything but junk plans. They are a great option for all Americans regardless of health status. As a former small business owner, I certainly would have appreciated the opportunity to have the choice that association health plans can offer. And Dr. Foxx, as you stated just a moment ago, employer-sponsored insurance on average provides richer and more robust coverage than plans on the Obamacare marketplace, and the majority of Americans are satisfied with their employer-sponsored plans. The Association Health Plans Act, which is part of the Choice Arrangement Act, would allow more small employers and self-employed individuals to band together to create an association health plan. Chairwoman Foxx, does this bill allow for association health plans to cherry pick which employees can participate?
Thank you very much for that question. Absolutely not. We need to say it over and over and over again. Association Health Plans Act explicitly prohibits AHPs from discriminating based on an individual's health status and does not allow them to raise premiums, rescind coverage, or create waiting periods for people with pre-existing conditions. And by the way, I need to say something about pre-existing conditions aside from your question. It was mentioned earlier that we didn't have coverage for pre-existing conditions in this country before, but I remember the debate on Obamacare. My recollection is we had 27 states that had pools for pre-existing conditions, and North Carolina was one of those states, and the average cost for premiums for the people in pre-existing condition pool was lower than for other plans. So if there were states that didn't have pools for pre-existing conditions, then they should have done it. The poor excuse for Obamacare was that it was going to cover all pre-existing conditions as though none were covered before was just not true. And let me come back now to the AHPs. They cannot charge individual employees different premiums based on their health status. They're treated just like large employers. The premium is based on the risk profile of the AHP, just like large employers. And then the premiums can vary based on the risk profile of the individual company. So it is not true that the association health plans discriminate on the basis of one's health status. We can't say that often enough.
And Chairwoman Foxx, does this bill discriminate against poorer or low-income employees?
No.
The self-insured market allows employers to have more control over plan benefit design and lower out-of-pocket costs for their employees. It's certainly a concept that I support. I continue to be dismayed by our colleagues on the other side of the aisle and the viewpoint that seems to consistently come out that government always knows best. Dr. Foxx, you aptly stated it always seems to come back to government control versus individual control or freedom of choice. I believe adding choice to the market is a good thing. I certainly prefer competition in the marketplace over bureaucratic government monopolies. Thank you for this legislation. Mr. Chairman, I yield back.
Thank you very much. I assume there's